Faced with a barrage of confusing, often conflicting information, there is an increased demand for balanced, evidence based commentary from media outlets worldwide. A recent research report by Expert File is encouraging more academic experts to become media engaged and media prepared. Dr. Michelle Cardell is an assistant professor in the Department of Health Outcomes and Biomedical Informatics at the University of Florida. She's an obesity and nutrition scientist, a registered dietitian, and a participant of that study. Thanks so much for taking some time for us.
Absolutely. Thanks for having me today.
There's so much important research taking place with significant implications in your area of study regarding healthy lifestyle interventions. What hesitations do you see in your colleagues around speaking to the media around their research and their important work?
I think the major hesitations that I hear from other scientists is the fear that their research will be misunderstood or that it will be misinterpreted and further the development of misinformation. In being in a field such as obesity and nutrition, there's already a great deal of misinformation being disseminated, and we want to be part of the solution, not part of the problem.
While speaking to a wide audience in widespread media like newspapers or broadcasts, it can be stressful. So, how have you developed a comfort zone working with journalists through your academic career?
I would say I'm always a work in progress. I always hope to continue to learn more and develop more in this area because I believe so strongly and so passionately about this. But the things that I have done to improve my skills in this area is seeking out additional training, specifically in communication. During the PhD process, it's very rare for somebody to acquire training skills in science communication. We focus very much on our content area. So my PhD is in nutrition science. I took classes in nutritional biochemistry and in physiology and in anatomy, but I never took a class solely focused on science communication. And I think that it's an essential component of what we do is not to just understand the data, but to share the data with others and to do so in a way that's accurate, but still understandable.
And speak the same language, absolutely. Well, I'm sure there's been rewards or benefits that engagement with journalists and the media have provided to you in terms of your academic work, but also to the university and to the community at large, given the information.
Yes, I certainly have felt significant benefits from it. People don't go into academia or go into research in hopes of becoming rich or famous. That's never the goal. The goal is to identify ways to make meaningful change in the health of others. And through science communication, we're able to better disseminate the information derived from our research. Currently, studies show that from the time of research discovery to implementation in clinical settings is an average of 17 years. So that means from the time we learn in our lab to the time that most people are doing it in their clinics is that 17-year period. And I think science communication can be a vital part of shortening that timeline down.
And when experts are providing information on issues like healthy lifestyle interventions, it also helps to demystify the academia side of it. And I mean, academics are real people.
Absolutely. I think it's in two part. I think one, people see academics as being part of the ivory tower and that we are unreachable and that, we are all nerds who don't like to talk to people. And that's just simply not the reality. Like you said, we're people just like everyone else. And most academics are eager and very excited to talk about their research. We just need additional training and opportunities in order to do that and to do so in an effective manner.
Well, on the other side of the coin, with so much public discourse, I mean, how important is it for journalists as well to include academics and evidence based information in their regular roster of sources?
I think it's absolutely essential. I think for journalists to provide the most accurate information to the public, that citing and interviewing and talking with credible experts, not just the people on TV or the big names, but the people who are on the ground doing the work in the lab, doing the research. I think that they are an untapped resource full of essential information that would be very beneficial for the American public to see. And I think during COVID-19, we've seen the benefits of having these experts on TV and to have them interviewed in these major newspapers and news outlets. We have benefited significantly from science communication from epidemiologists and virologists and physicians. And I would love to see more of that in the future.
Well, you talked about the importance of science communication. Do you think that universities are providing the supports their staff need to work with journalists, and how can they be doing that better?
I think that universities are starting to recognize the importance of science communication. I think most universities still need to do a little catch-up work in terms of their tenure and promotion processes in order to make that a part of evaluation. Currently, we are not evaluated on our science communication, and it really doesn't help much in terms of tenure and promotion. And as you well know, if you don't incentivize something, it's often left to the wayside for those things that are incentivized. And so if we want to get more scientists and academics out there talking with the public, we have to make it such that it will help their career, not hurt their career.
Well, there's no question that balanced, evidence based commentary from academic experts will help combat that proliferation of misinformation and disinformation. Dr. Cardell, thank you so much for sharing your experience with this study.
Yes, thank you so much for talking with me and doing work in this important area.